Medical News Minute. I'm Dr. Ernst von Schwarz. Today is February 25th, 2021. COVID by the numbers. So far, the US death toll has surpassed 500,000 people, and more than 28 million people have been infected with COVID-19 in the United States alone. Bad numbers. But fortunately, it seems to go in the right direction right now. I personally think the worst is over. But we are still dealing with COVID. An update on the variants. A group from the University of California, San Francisco has just shown some data that out of 320 patients infected with COVID, 69 were diagnosed with a new variant, which has the number B.1427 or B.1429, and which might be grown in California itself. That's a California variant of the coronavirus. And this variant might have a higher transmissibility and might be able to cause more severe disease than the older variants. Whether or not it can escape the vaccine-induced antibodies is not quite known at this point. An update on the new vaccine, which will come hopefully soon. The J&J vaccine represents an adenovirus. It's a single-shot vaccine, and it does not require the deep freezing, which is a good thing for all of us because it enables us hopefully to distribute this vaccine once it's FDA approved to a much broader public, because we can use it in all the doctor's offices. We don't need the environment of large vaccination centers for that. And lastly, a note on COVID recovery. We all have suffered from COVID more or less in different ways. Either we might have had the disease, or we might have had someone in our family or in our close contact who have died or suffered from the coronavirus infection. Besides that, of course, we all have suffered from the socio-economic crisis during the pandemic. We might have lost our jobs, earned less money. We couldn't go to soccer stadiums or concerts. So a lot of impact of all of us. So since obviously there's light at the end of the tunnel now, we are in the phase of the recovery. But for the recovery, we have to keep in mind there are some recommendations how to deal with that. And one thing I would like to emphasize is that the risk factors which determine whether or not someone dies of the coronavirus infection are actually essentially the same risk factors which lead to heart disease, strokes, heart attacks, and coronary vascular disease, which is uncontrolled high blood pressure, hypertension, uncontrolled diabetes, smoking, obesity. So especially during the COVID recovery, we have to address those, and that requires our own activation. There's no magic pill, but we have to follow a balanced, healthy, plant-based diet. We have to have a regular sleep pattern of ideally at least 7 hours per day. And we have to have an exercise regimen, ideally as recommended by the American Medical Association, 5 days a week, 30 minutes of moderate intensity exercise, at least at a minimum, in order to strengthen our immune system and in order to overcome our risk factors. More to come. We've written this up in a small e-booklet free of charge, what you need to know about the COVID recovery on our website. Thank you very much.